We're at day 2 here of the Physios in Sport conference at Birmingham, and we're joined by Alastair Little and Phil Glasgow, where we're going to just ask them a few questions about the talks that they've just done. Phil Glasgow was talking about Bryce to Peace and Love, and Alastair Little gave us a little synopsis of his experiences of acute injury with working with Scotland Rugby.
Okay, so for bulk of the conversation was around ice. I thought, and I think that's a really good place to start, because maybe 2-3 weeks ago acute injury management was the topic that we talked about on Clubhouse, and from our perspective as students, this whole evolution has kind of been drummed into us. And our first year of uni, it was still very much police, and then more recently it's been peace and love, but we weren't actually taught it, so this was kind of off our own back to go and find that this is the new sort of approach to it. At the time, my first thought was, well, ice still very much has a place exactly on the point that you just made about, well, if someone's still in pain, how can we expect to do rehabilitation? So if ice can help to manage pain, then that can help us to get on our way. The first question I had, which kind of, it wasn't quite put on the presentation, but it kind of sparked what I was looking to say, was how much of an effect would ice have on the actual proliferation stage, in terms of how much of a delay could we expect to have from ice in that early process?
It's a really good question, and I think bottom line is, if you apply it appropriately, very little, negative effect. And I think we're not getting anywhere close to the temperature reductions within the tissues that would have really significant effects. And if you think of most icing protocols, tend to be put them on for 20 minutes on, 20 minutes off, or 20 minutes every hour. That level of application of ice for tissues, we know we're probably only getting up maybe 2-3, maximum 5 degrees worth of temperature reductions, rather than that window of sort of 5 to 50, or less than 15 degrees tissue temperature. So the effects on proliferation is going to be minimal, but what we are going to get within minutes will be that analgesic effect, as you say, which then the sort of the muscle spasm, the secondary sort of apprehension to move, we'll deal with that. So I think this is one of those cases where this is what the basic science says. Now let's apply it in the real world, and the importance of looking at it in context. So it's with most of these things, it's neither an out or in question, but it's so how do we use that information to apply it for the benefit of our athletes, players, patients. Yeah.
Right, and then a question I had for you, Alastair, was what are your views on rehab times if a player doesn't want or need to rush back for selection, like you mentioned in the talk just there? Would you take the extra time, or still try to get them back as soon as possible?
I think it's an interesting question. You also need to think about what stage they're at in their development. So if they're a young academy player, then I would probably take the time with them to get things right. If you're working in professional sport, then time is key. It doesn't really matter if they've not got competition for the next few weeks. The coach wants them back as soon as they can. So you kind of have to work within the safe parameters of that injury with that person, and come to a collaboration with that and the coach and the strength and conditioner to make sure that you're getting them back into play at the right time. So essentially, be safe with it, I think, is the main thing that I would go for. You can push the boundaries, certainly, and just see how you go with these things, but depending on the athletic maturity of that person will dictate how you want to approach it.
And I suppose another area that kind of feeds into what you're saying about the sort of risk that you take, the draining of fluid. One of the things that you had made, one of the points that you had made about, does that not sort of remove that inflammatory soup as such, that sort of cauldron of what's going on? If we're draining it, are we not, in essence, kind of taking away almost the fuel that we need to get that process kicking off?
I think for me, it probably depends on the situation that you're in. For the cauliflower ear, for example, if that person's not able to train effectively enough, then that would be something you would do. And I know with regards to the quadriceps, certainly with us in Scottish Rugby, it's probably not something that we'd look to do all the time. I think if it's affecting the player longer term, if that's 1 week, 2 week down the line and they've still got this massive hemarthrosis and they're not having issues with, they're not able to train with that, then it's maybe something that you look to do going forward. I'm not sure what you think about that, Phil.
Yeah, I think I totally agree with Ali. And the other thing is that quite often, depending on the degree of the injury, the body switch on and can sort of overreact at times, and where it's very extreme amounts of bleeding or swelling, and so most of the time the aspiration, I think, is for pain relief, symptomatic. I can think of like a road cyclist who came off, hit a bollard. I remember we took 150 mils of fluid off his sort of paraspinals, and the immediate relief and pain and everything changed with that. So sometimes it's about symptomatic relief. I think there's enough of that stuff going on in that soup, if you like. There's still going to be enough of it around. We don't aspirate routinely because we know that usually if left unattended, it just fills back up again. So the fluid's there. So we certainly, taking into account risks of infection and everything, it's not a routine thing. But where it's really significant, or it's a particular thing like cauliflower ear, I think that's when it's indicated. So it's certainly not a routine, and it's very much around clinical decision making.
And then just to zoom out, if I may, a common theme that I think I've kind of drawn from the conference so far is that physio should be a little bit more concerned with communicating, listening and applying contextually appropriate treatment to the patient in front of us, rather than being worried about diagnosing and solving the problem. Is that something that you would agree as a theme that you're trying to kind of get across from everything that you're saying?
Yeah, I think so, definitely. It almost comes back to the treat the man, not the scan type thing. You want to see what the person is in front of you doing, that communicating effectively and seeing how they're going with it, especially when it comes to a loading perspective as well. You want to let them tell you how it feels, because you could be in your mind, right, we need to get this back, we need to load this sooner, whereas they're still uncomfortable with it. And there's that degree of safety you have to have around that as well. So yeah, definitely that communication is key, and don't be too focused on trying to get this right diagnostic thing, and eventually every injury will get better, I think, at the end of the day. So if you're trying to sort of push the boundaries on it, you have to keep talking to the athlete and keep making sure that they're on board with everything that you're saying as well.
It's that old adage that I really, really like, and I quote regularly, is if you listen to your patient, they'll tell you what's wrong with them, and if you listen to them a little bit longer, they'll tell you how to make them better. Yeah, and so really listening, taking time to that it's a dialogue. We like the idea of this diagnostic approach that I've got the answer, this is what you got to do, but actually working in partnership, as Ali says. Talking and in a sense coming together and finding the right solution for that person. The importance of really properly listening and listening to really understand their context and their issue, as opposed to listening just so that I can tell you and show you how much I know. Two very different approaches, so I think it's a really critical point. Yeah,
I think that sort of working in unison is so important, that I think at university that gets quite lost in the early days, because it's so heavily focused on like assessment methods, and this is the anatomy and this is how it works and this is what you're going to do to fix it, and you actually forget about the person that's sitting in front of you, and how that what they say might only sort of fit sort of 10% with what the books say in terms of what you need to do, and that kind of fits into what I wanted to ask next. So obviously Ireland have been quite successful for probably the last sort of 5-6 years, and Scottish rugby has ascended quite astronomically in the past couple of years, and I think that comes back to the culture that's going on. I think there's a lot of talk about high performance now, and what actually is high performance, and terming high performance and what that culture is. How do the medical teams at Ireland and Scotland meet the demands of the high performance of the athletes within the medical teams?
I was hoping you were going to go first there, Ali. Do you know, the term that we use, and again we use in EISO, and is that when we refer to the services, we're the performance support services, our primary job is to support performance. So it's about looking at where can my role, whether that's in the technical component of the physio or whether it's just me being part of the team, how can I positively contribute to performance? And I think in our performance support program where we sit, there are three really key things that we have. Number one is how we connect. How we connect with each other within our team, how we connect with our players, how we connect with the broader goals of the squad, how we connect with the environment and help to foster an environment that is about trust, where people know that they're supported, an environment where it's clear what success looks like. And then we move from that connect into deliver. So we deliver stuff that's really clear, we own it, we've got our own ownership, we've got good accountability, but we do that very much in a collaborative way and an integrated approach. So it's not just physios over here, coaching's there, but we actually sit down and we plan collectively. So it's an integrated into the deliver, and then the third part is connect, deliver, and the third part's excel. It's because we're always reflecting, always adapting, always wanting to get better. You can always be better, you can always improve, and so being open and having that really good review, having the opportunity to reflect and say what went well, why did it go well, what contributed to it, and how can we get better. And so for me, that epitomises a high performance environment. It's one where there's a tight group of people who are working at a high level but are constantly looking for opportunities to get better, and every one of us has a role to play in that, and we play our role, but we contribute more than just our narrow definition of what a physio is, if that makes sense.
I think Phil's probably hit the nail on the head with that as well. You have to it's a constant review process. At the end of every campaign, at the end of every game, you kind of look back at what you've done and how you can improve to week, day to day, and certainly not just within your own little silo, within all the different aspects of performance. And I think you have to be open for people from the outside looking in and giving you that feedback as well, and be able to give that feedback to other people without fear of getting your back up or being upset because somebody said, oh, you're not doing that well enough, what about this? Because if you end up doing that, then you're not going to improve, you're not going to make yourself a better person. It's not going to make yourself, the team ultimately is what you're trying to make better, and with doing things at a certain level, that ultimate goal is not going to improve. So you always have to be sort of challenging yourself and taking a, for want of a better phrase, a helicopter view and looking at different things and just seeing how else you can improve going forward.
Yeah, and then just to round it off, something on that similar topic I just wanted to ask was, do you think part of that being a high performance team and striving for that almost perfection, the thing that makes the team so high performing is actually that understanding that you might never reach perfect, but it's okay to accept that you can still strive for that?
Definitely. I think for teams that are at the top of their game, they never want to stay. They never want to just be happy with cruising along there. They've always got to have that 1% better. You look at the All Blacks, for example, and they've been the best team in the world for X amount of years because they don't just rest on their laurels. They're always looking for things to make them better. And so, as teams like Scotland to aspire to be that, we always have to be looking to see what we can do to change things, looking for different options. The coaching staff are always looking for different ideas for training methods and how to make things better. We're always looking at different ways to make recovery better for the players and to make the environment within the team hotel when we go away like a home from home, so that they feel that they're not just coming into a hotel environment and it's not this and the food's not great, and it's all these little things that you add together to make a sort of melting pot of different things that comes out with the ultimate ingredients for, similar to Caroline's thing this morning, it's the biopsychosocial thing with the pancake. So for us, you just can't be sitting and going, well, we're happy with that. We've beaten England this week and maybe we'll beat Wales next week or whatever, and be resting on that. You've always got to look for the next thing to challenge you, to push things forward. And if you don't do that as a performance team, I think you'll never get to the All Black stages or even Ireland. Look at where they are this year. They were contesting for Grand Slam and all the rest of it, and be big contenders for the World Cup coming next year as well. So yeah, we always looking out at different teams and how they do things and what they can do as well to make things better for us.
And you've experienced it yourself as well. I think there's a great example that someone said, and I I think I know who said it, but I'll probably get it wrong, so I'll just say somebody said, it's not that you are great, but from time to time you access greatness. And because it's this thing that on that day, it clicked and it was great. And if you play golf, you just hit a ball really sweetly, and the next one, it's not just as good. It doesn't make you a bad golfer or a good golfer. And that, I think, performance is like that. You get that amazing game, like for example against England, but then the thing that drives you on is going, I want to do that again. That's what real performance to me is about. It's constantly saying to access that where you just get it right, and you probably fall a little bit short more often than you get it, and it's the pursuit of that to me that is why we do it, and how you can contribute to that. Like that's the joy of sport, isn't it? Yeah.